Good day. I am John Robert Guillergan, a student under the Master of Arts in Nursing major in Medical Surgical Nursing. I will be presenting my proposed study in conducting an epidemiological investigation on the rise of pertussis among children in Iloilo City. Pertussis is one of the vaccine-preventable diseases among children. According to the Centers for Disease Control and Prevention, or CDC, pertussis, also known as whooping cough, is a respiratory illness caused by a type of bacteria called Bordetella pertussis. This disease is only found in humans. The bacteria that cause whooping cough spread easily from person to person. When a person with whooping cough sneezes or coughs, they release small particles with the bacteria in them. Other people can then breathe in the bacteria. In 2022, there were more than 62,500 cases of pertussis globally, and nearly 39,000 cases were reported in the Western Pacific region, which had 92% coverage with 3 doses of diphtheria, tetanus, pertussis vaccine. According to the World Health Organization, it was reported that 14.5 million infants did not receive an initial dose of DTP vaccine, pointing to a lack of access to immunization and other health services, and an additional of 6.5 million are partially vaccinated. Of the 21 million, just under 60% of these children live in 10 countries, namely Afghanistan, Angola, the Democratic Republic of the Congo, Ethiopia, India, Indonesia, Nigeria, Pakistan, Sudan, and Yemen. During 2023, about 84% of the infants worldwide, or 108 million, received 3 doses of diphtheria, tetanus, pertussis vaccine, protecting them from infectious diseases that can cause serious illness and disability or be fatal. However, these global figures hide significant disparity among countries of different income strata, with low-income countries lagging behind. In the Philippines, the Department of Health said that the pertussis cases were still on an upward trend after data showed more than 1,500 infections recorded as of April 13, 2024. According to Kasukian in a GMA News report, Iloilo City has been placed under a state of calamity only after a day declaring an outbreak of pertussis or whooping cough. In a statement from the LGU, the city currently has a total of 16 cases of pertussis, 7 of which are confirmed cases from the districts of Molo, Haro, and Lapus. Currently, as of August 31, 2024, from the Iloilo City Epidemiology and Surveillance Unit, a total of 18 confirmed cases are recorded. According to the Department of Health, this transmission may be prevented by good respiratory hygiene. And washing of hands often or use of alcohol if soap and water are not readily available. Further, it is studied that vaccination is safe and effective against pertussis. According to Kapuyan, the overall goal of the expanded program on immunization, now transitioned to be the National Immunization Program, is to reduce the morbidity and mortality among children against the most common vaccine-preventable diseases. One of the program's specific goals is to control diphtheria, pertussis, hepatitis B, and German measles, with a program target of achieving 95% fully immunized child coverage. However, according to UNICEF, routine immunization coverage among children in the Philippines has not reached the ideal 95% target, with the coverage rate for many vaccines declining from 2010 to 2021. This resulted in measles and polio outbreaks in the country in 2019, placing children at risk of these life-threatening diseases. Between 2019 and 2021, there were estimated declines in the coverage of DTP1, DPT3, measles, and BCG, from roughly 75% to 57%. In 2021, the Philippines was listed as one of the 10 countries with the highest number of zero-dose children worldwide. According to the study conducted by Alcala et al., only 41% of children of the four-piece beneficiaries were compliant to the EPI with area of residence, considered as a factor in completeness of immunization in two barangays. Barriers identified with non-compliance include lack of vaccine supply, lack of knowledge on vaccine availability, and childhood illnesses. The purpose of this study is to conduct an, epi- an epidemiological investigation on the rise of pertussis among children in Iloilo City. Specifically, the study aims to determine the environmental factors that led to the rise of pertussis among children in Iloilo City, determine the personal factors that led to the rise of pertussis, and as well as determine the number of cases of pertussis in Iloilo City. This study will be significant to the following. Firstly, Iloilo City Health Officer. They will be able to improve vaccination efforts and health education among the inhabitants and prepare prevention initiatives in response to other reemergence of vaccine preventable diseases. To the DOH personnel, they will be able to utilize the data gathered to bolster vaccination initiatives as well as provide support to LGUs experiencing outbreaks. To healthcare workers, they can adapt to evidence-based strategies in caring for patients with pertussis, improve health education, and come up with effective data gathering methods. To the parents, they will be educated on the importance of vaccination as one of the best methods in preventing pertussis and other diseases among children. And lastly, future researchers. They will conduct further studies on pertussis and other diseases in order to develop new strategies and data collection in response to potential outbreaks. This study will be utilizing a descriptive epidemiological study based on a case control approach. The sampling technique to be used is judgment sampling. The study population will include subjects with confirmed cases of pertussis and subjects without the disease. The inclusion criteria includes age of 0 to 12 years old, locations with recorded cases, and clinically diagnosed or confirmed cases. The exclusion criteria are those who are probable cases, cases referred from or living outside of Iloilo City. As the nature of the study is retrospective, the researcher will utilize existing data from the Iloilo City Health Office in identifying the subjects with confirmed cases of pertussis. The statistical test to be used, the study will be using percentage to identify which of the factors occurs frequently in relation to the rise of pertussis. The study will also utilize the odds ratio, an epidemiological measure of association. It is the ratio of odds to exposure in diseased subjects to the odds of exposure in the non-diseased. And to test the degree of correlation between the variables, the Pearson product moment correlation coefficient will be used. These are my references, and thank you.